Good afternoon, and thank you for joining us today for NOCC's Ask the Experts. I'm Alana Feuchter, Patient Insights Advisor, and today we are joined by Dr. Dana Chase of US Oncology in Arizona as we talk about cancer survivorship plans, what it is, what it should contain, and how you can create one of your own. We encourage you to use the chat function below to tell us where you're from and also to ask questions along the way, which we will leave time for answers at the end. Before we start, I want to tell you a little bit about Dr. Chase. She is a board-certified gynecologic oncologist whose expertise includes research and collaborative projects with colleagues on scientific questions related to quality of life, symptom management, and supportive care. She is a member of NRG Oncology, the Society of Gynecologic Oncology, American Society of Clinical Oncology, and a fellow of the American College of Obstetricians and Gynecologists. Dr. Chase has over 30 peer-reviewed publications and 35 abstracts presented at organizational meetings. Welcome, Dr. Chase.
Thank you. Thanks for having me. I'm super excited to be involved in this and talk about survivorship. That's really awesome that you invited me to join you today. So thanks, Alana.
Well, thank you. We're super happy to have you here. We'll just start right in here. So maybe can you explain what is a survivorship care plan and how is it intended to best help someone who is diagnosed with ovarian cancer?
So a survivorship care plan can have a wide definition. It could be at the completion of a surgery for a cancer, or it could be at the completion of radiation therapy, or the completion of chemotherapy, or the completion of all three different modalities, if that's the type of treatment you had. This, when a patient finishes cancer treatment, whether or not it's surgery, radiation, and/or chemo, there's a lot of questions as to what's going to happen next. The patient has usually undergone a lot of different treatments, had different side effects, different experiences, and I think there's a lot of buildup to this period of remission and kind of an unknown in terms of what to do next, how to be active in your remission or active in your surveillance. And so I think a survivorship care plan helps the patient and the family members or friends understand what to look out for, when to come back for follow-up, what kind of follow-up testing is needed. It can be really vague, but it can also be pretty specific.
I think there's, as you were talking, I was jotting a little note down. I think there's always people who question what is a survivor. So that really goes back to what is a survivorship plan. And some people say, well, I'm not a survivor because I didn't get into remission. But, for our definition, we are talking about anybody who has been diagnosed and is currently either, in remission or currently being treated for ovarian cancer. So I just wanted to be clear that, because some people say, like, I'm not a survivor, but you are. We consider everybody a survivor from the day that you are first diagnosed.
Right. That's definitely a good point.
I should have explained that before we even started. So maybe, Dr. Chase, can you say what kind of information would you contain within this kind of care plan?
So, usually what I like to do is review with the patient everything that they just had happen to them. So like you said, it could be very different for each patient. Some patients, they've just completed a bunch of treatments. Some patients just have had surgery. And so I think it's important to kind of review what you went through and what's going to happen next. So I like to summarize the treatment that you've had, which could involve printing out records that maybe the patient's misplaced or forgot to get a hold of, jotting down what kind of medications they received, jotting down what kind of radiation they received, or making sure they're understanding in terms of their cancer diagnosis and the surgery that they had or the parts they had removed. So I think summarizing, what happened is always really helpful. That's one part of it. The next part of it is follow-up care. So when to come back to the doctor, what test maybe to have before you come back, lots of patients have a question about blood work or CT scans. If that's going to happen, how is it going to happen? And then another component is what to look out for. What symptoms should I watch for? Whether or not I'm in remission or still have cancer in my body. What to look out for and what to report back to the doctor. When to come sooner than your scheduled appointment. That kind of information. And then I think the fourth thing is kind of what can I do as the patient? What can I do to help myself feel better, or even to help myself do better with living with this cancer or in my remission? And so that could involve things like going to see a nutritionist or seeing a genetic counselor or having an exercise program or finding a way to control stress. So possibly there's like 4 different components to it, just to summarize what I went through, what I'm going to do for follow-up, what symptoms to watch out for, and then how I can help myself to kind of be healthier moving forward.
Great. I think that was a good explanation of what should be contained. How about as a survivor looks ahead, should they be considering legal or financial issues that might implicate or might have implications for moving forward? Talk about any kind of health benefits, the insurance company that they're dealing with, any of that information would you suggest gets included?
Yeah, I mean, I think definitely important to have sort of documents in order for power of attorney or documents that might help you should you be in a situation where you're unable to make decisions for yourself and you want a certain family member or friend to be there for you and make those decisions. I mean, none of us really want to talk about that, but the reality is when we're healthy and when we're feeling good is a good time to have that discussion and to have those documents in order. Again, not something that's easy to talk about because we're surviving and we want to talk about healthy things, but it's also a good time where your brain is clear that potentially you can think about important things like that. And then, a lot of practices these days have patient benefits administrators. And so those are people that are really, I think we forget that they're available to patients, and those people are very helpful with patients in terms of getting insurance issues or payments or finances related to healthcare in order. And they're actually in the clinic many times these days and can answer questions about health insurance and benefits and payments and stuff like that. So there's I do feel like those 2 components should be included, and maybe something that we don't talk about as much as we probably should.
Thank you. If you were to put together a plan, let's say for one of your patients, what kind of level of detail do you get into? Do you talk about things like, okay, after treatment, I will see you in 3 months. I will see you in 6 months. We will do blood work at X amount of time. We will do a CT at this amount. Do you think that kind of detail should be included for the patient in a care survivorship plan?
Yeah, I think, yes, I think for sure important to emphasize follow-up and definitely getting the patient on a plan to follow up. It was very hard during COVID, I think, to make sure that people were following up and knew the plan. And I'm seeing that a lot now that we kind of lost track, a lot of us, patients and offices, in terms of how people should be following up. Now that we have a little bit of breathing room and we're trying to reorganize, definitely important to emphasize follow-up, because I have seen patients kind of slip through the cracks in terms of follow-up, like, oops, I should have come back 3 months and it's now 9 months later and COVID got in the way or I couldn't travel or whatever. So I think important to definitely question follow-up and to try to make the doctor or the provider really write that in stone for you so that you don't forget. Again, most clinics these days have electronic medical records, and many of them many clinics have automated appointment messages and stuff like that. So if the doctor is able to put in an automatic, this patient should return every 3 months for 2 years, that will alert sometimes systems in place to remind you about appointments. But that being said, that doesn't always work perfectly. So making sure that's written down somewhere, either on a care plan or in your phone, is really important.
Mm-hmm. If a survivor has other comorbidities, things like diabetes or high blood pressure, do they need to incorporate that into their survivorship plan? In other words, maybe seeing some other physicians that are related, or even, let's say, neuropathy that they have after treatment. Should that be included?
Yeah, I mean, that is a really, really great point. Again, when patients are undergoing treatment for cancer, a lot of these comorbidities or other medical problems that you have kind of go away miraculously. We forget about them because we're dealing with something so big like a cancer diagnosis. But when you have some breathing room and you're talking about a survivorship plan, that's a perfect time to revisit your primary care provider, to go back to your family practice or your internist to make sure your diabetes is under control, make sure your blood pressure has been good, make sure you're up to date in terms of bone density or colonoscopy or mammogram. So it is really a good opportunity to remember to go back and follow up on some of your other medical problems that maybe you have not been paying attention to so well because of the cancer treatment. So I think that's potentially, in the part of the care plan where it's like, what can I do? I think that is something you could do for sure, is make sure you're not forgetting about other parts of the body, not just the pelvis, but even things above the chest, like the heart and the lungs. So yeah, for sure, important to remember follow-up care for other medical issues that you may have, or even cancer screening that doesn't involve the ovary or the GYN system. So, don't forget about mammograms. Don't forget about colonoscopy. When you're in remission or when you're not getting cancer treatment, that's sometimes a great time to re-examine the colon and the breast, for example.
Exactly. The dermatologist.
Dermatologist, yes, thank you.
Yes. Yes, no, when you were saying that, I was thinking of all those, the doctors that you're supposed to see. And some of them may even be, or the appointments you're supposed to have, some of them may even be related to the cancer, but like kind of peripherally, like bone density that you said. Because, if you are in menopause or if you were put into menopause, those kinds of tests are important, and they're important to continue, for a period after time, just because you are more at risk for bone loss, of course, after being put into menopause. So those are the kinds of things that are especially important as well. Thank you for bringing that up. Where can someone find examples and templates of care plans, and what would be the first step in creating one?
Yeah, so I mean, there's many different places that you can find templates for care plans. These days, in your doctor's office, for example, there are usually within the electronic medical record, there's some kind of a summary page. If for some reason your physician or your provider does not have like a summary page or a care plan page, you can always request a copy of your note, because usually your note will have your diagnosis, your treatment that you've gotten, and your follow-up. And so if the physician or the healthcare provider didn't have time to go over and fill out a whole care plan with you, at least you can find some of that information in your prior note. And potentially, if you go into ASCO or American Cancer Society, websites like that, you could probably even just Google, cancer survivor plan. You could fill in a care plan yourself if your physician or your health provider didn't do it for you. And definitely, I would kind of, with the care plan, I would keep other files that I think are really helpful, like make sure you would get a copy of your pathology report. it still amazes me sometimes that patients don't have copies of their pathology report. So a pathology report is basically if you had a biopsy or if you had a surgery, it's a report of the tissue that you had removed and what the diagnosis was. And you I really strongly recommend that you staple that to your care plan, because if you change doctors or if you have to show your primary care doctor something, at least you'll have that pathology report that really spells out exactly what your diagnosis was. And potentially getting a summary of the medications you received or a summary of the radiation treatment plan you had. Again, staple that to your care plan and have that in the same place so that you can always refer back to it.
You were saying that, I was thinking of something else. How about including your list of medications or medications maybe that you're allergic to in there as well, because that's a question that often comes up as well. So
yeah, I think that's a good point too, because sometimes a patient, when she's getting chemotherapy, she'll be allergic to some of the medications she's receiving. Not necessarily the chemotherapy, but some of the supportive medications. And as time goes on, you may forget that you have that sensitivity. And if you need to get treatment again in the future for some reason, hopefully not, but if you do in the future, really helpful to know, oh, I was allergic to that medication that controls nausea, and that will help us avoid some of the side effects for your next treatments should you need that. Really important, which I think also patients, sometimes radiation is such this abstract treatment that people don't really understand in terms of what happened or what they received. And so sometimes really critical to really make sure you have a copy of what exactly was radiated in your body and how many days you got it and what the total dose was. That will help doctors down the road know what to give you or what not to give you. So don't forget to have a summary of the radiation you received.
that's great news, or great information. We have a number of questions, so I'm going to dive into those right now. Melissa said, shouldn't a CA-125 be checked yearly with your doctor? All the symptoms go along with typical, I'm not sure, it's not a full sentence, but would you do a CA-125 yearly? Is that your recommendation?
Yeah, so I will say that CA-125, let me first say CA-125 is a way that we can monitor ovarian cancer when a patient's in remission or when she's getting treatment to see what her response is. So while you're getting treatment, you can get the CA-125 done, like, for example, every 3 to 4 weeks. And you can monitor the trend, not just the single number, but the trend of that number to kind of see how the treatment is, how you're responding to the treatment. Now, I must say some women don't really have CA-125 as a marker for them, meaning it might be good for you, but not for me. It's not a good marker for me. You'll hear people say that, but many of us monitor the CA-125 during treatment. Now, in survivorship or in remission, I must say doctors do it differently. So I, for example, try to monitor the CA-125 for the first 2 years every 3 months. And there's 3 things that help me in remission or in survivorship. Number 1, how you're feeling. Number 2, what your exam is, what your pelvic exam is, or your physical exam. And number 3, the CA-125. So how you're feeling, your exam, and the CA-125. Those 3 things every 3 months can help me kind of determine if I need to order a CAT scan or if I should be concerned for recurrence. I have noticed, though, that other doctors do not order CA-125 very frequently. They prefer just to go off of how you're feeling and what your exam is. And I want to emphasize there's really no right answer. It's kind of a conversation you should have with your doctor or with your healthcare provider about how you want to be monitored and what you feel comfortable with. Again, you might have a doctor that just wants to monitor it once a year, but you might have a doctor that wants to monitor it at once every 3 months or every 6 months. It's sort of variable. Just make sure you have a conversation about intentions and what's on the plan. And so definitely having a CA-125 discussion should be part of that survivorship care discussion that you have with your physician.
Another question that came up is, do you have any tips to support talking about survivorship plans with your family?
Yeah, I mean, I suppose, I suppose that could be definitely stressful, definitely, including family members in your plan can be uncomfortable, especially if you're discussing some of these legal issues that we talked about earlier. Um, you know, Sometimes I found with patients when they share with their family members some of the unknown is easier to digest later on. And so, you know, expectations about what's going to happen, knowing what your percent chance is for a recurrence, for example, could be part of a care plan. And that should be shared with family members. Sometimes down the road, the family member will say, gosh, I had no idea, Dr. Chase, you never told us that this was going to happen. Or, so I do think involving family members in, the possibilities for recurrence or retreatment is important. And in terms of having a way to introduce that to them, I think, I think what is helpful is to say to the family member, I realize this might be stressful to you, me sharing potentially things that could be bad news, but I need you to be there to help me when things are not going to be great. And the way that you can help me feel better is to know what happened to me and know how to help me in the future. And that actually will help me feel better as the patient. So I think making the family member feel empowered to help you feel better is maybe a good way to introduce that to them. But these are obviously difficult discussions to have, especially if you have children that are young, for example, or a spouse that maybe isn't coping well with your treatment that you went through. It can be very difficult. But I think if you come at it like, knowing this helps me, maybe that makes it a little easier for them to be strong for you.
Yes, for sure. We have a question about someone still has their cervix and uterus in place after being diagnosed. Should they still be getting PAPs?
Yeah, so
Survivorship.
Pap smears are screening tests for cervical cancer. So if you have had a Pap smear in the past that stated that you had HPV, which is the human papillomavirus, so HPV, if you had an HPV test that was positive in the past, you probably at least need one more Pap smear to see if you have HPV. Even though you've had ovarian cancer and you've had chemotherapy, if your cervix is still there, especially, you probably at least need one Pap smear to tell you what your HPV status is. There can be so many different varieties of history there that I don't want to generalize, but just if you still have your cervix, know your HPV status, and maybe at least just get one new Pap smear to kind of tell you where you are, and then your doctor can just decide whether or not you need to have one annually every year, or once every 3 years, or once every 5 years, or maybe even your doctor's going to say, you know what, you're done. If you've had a hysterectomy, though, if you've had the cervix removed at the time of your ovarian cancer surgery, the guidelines say if you've had no abnormal Pap smears, meaning nothing abnormal, no HPV, nothing, in the last 20 years, you never have to have a Pap smear ever again. So if you've had a hysterectomy with removal of your cervix and your uterus, and you've never had an abnormal Pap in the last 20 years, you don't need to have a Pap smear again. But that potentially could be involved in a care plan for sure, whether or not you need to have a follow-up Pap smear.
I'm looking for some other questions. I'm sorry. A lot of people just chiming in about their caregivers, their family. And so thank you, all of you who are watching and chiming in. Okay, here's a question. For some patients, cutting edge things like the PARP inhibitor, I wouldn't even cutting edge. I think that's kind of standard of care, but this person says they can be aggressive on the body. Is there alternatives, or what kind of things would you consider for maintenance, which is obviously part of the survivorship?
Yeah, we haven't talked about maintenance yet, which could be very important for ovarian cancer patients. So for sure, many ovarian cancer patients in their survivorship care plan is whether or not they're still on some kind of a treatment, like a maintenance treatment. And for sure, PARP inhibitors are becoming pretty mainstream for ovarian cancer patients. For sure, if you're an ovarian cancer patient and you've never heard of a PARP inhibitor, nobody's ever talked to you about it, you for sure should ask your doctor or your healthcare provider about the PARP inhibitor, just to introduce it into their mind and see if they've thought about it for you. In terms of alternatives, maintenance has become pretty mainstream these days for ovarian cancer patients, and that maintenance can either be with a PARP inhibitor or with a drug called bevacizumab, or potentially with both bevacizumab and the PARP inhibitor. So again, you could have a PARP inhibitor, you could have bevacizumab, or you could have the two of them together. And then the fourth option is that you're in what we call just active surveillance, meaning you're not on a maintenance treatment, but you are being watched very carefully, like every 3 months with a blood test and a pelvic exam and an occasional CAT scan. And so in terms of alternatives to PARP inhibitor maintenance, the alternative is bevacizumab or just active surveillance. We don't really yet have something else to offer. Maybe down the road we will, but currently no real alternative to a PARP inhibitor. So if you are on a PARP inhibitor in your, as part of your care plan, and you're suffering from side effects, that should definitely be something that you are having follow-up for, at least telemedicine, phone calls for symptom management. And I feel strongly about that definitely advocating for the side effects you're having while you're on the PARP inhibitor are important, because I will tell you, if you are having good follow-up and you are in contact with the office that's taking care of you, there are ways to manage those side effects. And that's important for patients to advocate for themselves in terms of taking a break from the pill, or lowering the dose, or switching to a different type. I mean, definitely reaching out to us and letting us know that you're suffering is really important. So don't hesitate to contact the doctor's office and speak up for yourself if you're having trouble, because there are things that we can do. There's medications we can introduce to help support things like nausea. There's dose reductions, and then we can actually have you take a break if you're not feeling so well. So definitely reach out if you're having symptoms, even if they're mild.
Excellent. Thank you so much. I think all of the other comments are more personal questions, which we're not going to answer here, because I think that these are questions that need to be addressed to an individual's particular doctor. So I'd like for us to wrap it up. I want to thank you very much, Dr. Chase, for joining us today and offering so much information. I hope everybody who has watched this feels like they have a better idea of what a cancer survivorship plan is and how to build one for themselves. I do want to encourage everyone to consider filling out the survey that appears in the chat box and letting us know if there's topics that you want to see in the future. We'd love to hear from you. We do have next month a group of survivors, a panel of survivors who will be talking about what I wish I knew, and they will be talking to new survivors to kind of give them the lessons learned. And I hope everyone has a wonderful rest of your day and a great Memorial Day weekend. Thank you again, Dr. Chase.
Thanks for having me. Take care of everybody. Stay healthy.